Hello, this is Tom Davis. I'm Partnership Leader for Health and Nutrition for World Vision International, and this presentation is on the case for demand-side funding and interventions for COVID-19 vaccinations. So in this pandemic, there's been too little focus on the human element. A 2021 World Bank assessment of national deployment and vaccination plans found that the world's poorest countries are at varying degrees of readiness for the massive undertaking of vaccinating their populations. While 85% of countries have developed national vaccination plans and 68% have vaccine safety systems, only 30% have developed processes to train the large number of vaccinators who will be needed for the campaign, both for increasing vaccine acceptance and actually vaccinating people. And only 27% have created social mobilization and public engagement strategies to encourage people to get vaccinated. There's also been too little involvement of local communities in those NDVPs. Most of those plans were prepared without the engagement of civil society or key local actors, and that can jeopardize trust in vaccines and vaccine uptake. In a study World Vision conducted back in May of 2021, we found that 68% of respondents had not even heard of plans for vaccinations in their communities, and nearly half, 47%, thought they were not eligible or did not know if they were eligible for a vaccination. We learned from our Ebola response that trust is better built by community health workers, faith leaders, and other local frontline partners since they relate to and work with communities on a daily basis, but they need to be consulted and included in vaccination plans. We have tools that can be used to better understand which groups are seeking out vaccines, why some people in groups are seeking COVID-19 vaccines and others are not, and monitoring of rumors, but they're not routinely applied. That's in part because there was never any plan to do so, because that piece was often left out of NDVPs, but in part it's due to scarce funding for formative research. UN agencies and INGOs have heavily invested in these tools over the years, so we have tools that we could be leveraging, such as barrier analysis, the WHO's behavioral and social drivers tools, UNICEF's Vaccination Data Observatory, WHO's early AI-supported response with social listening or EARS platform, and others. We also have evidence-based tools and models for promoting vaccinations that are built on behavioral science, and we should be using those to fight COVID-19. For example, the care group approach, which leverages a second tier of volunteer community health workers who are chosen by the people they serve, have been shown to achieve double the behavior change of other CHW-led behavior change approaches. They have been used to achieve significant improvements in both vaccination coverage and vaccination equity. Social accountability models, such as World Vision's Citizens' Voice in Action model, should be leveraged to help hold governments accountable for the commitments they're making on vaccines. To reach and engage faith leaders across the spectrum, we have models such as World Vision's Channels of Hope and similar models. There are models that use nudges and peer influencers to increase behaviors such as Innovation for Poverty Action, Yale, and Stanford's Normalize intervention. There are also influencer marketing platforms that we should be testing, such as AI Fluence's platform, which is used to find, recruit, and use influencers' voices across multiple social media platforms to bring about behavior and norm change regarding vaccines and other behaviors. And of course, one of the biggest resources we have to increase vaccine acceptance and influence social norms is community health workers. There are dozens of good studies on the role of community health workers during the pandemic, a few of which I've shown here. World Vision works with more than 186,000 community health workers, and in a study we conducted last year, we found that 98% of those community health workers were continuing to circulate and provide their services, even though 74% of them were in countries that had put in place restrictions on movement. Community health workers are often highly trusted sources of health information, but we need to train them and mobilize them to be effective promoters of COVID-19 vaccines. So it's not just about promoting advantages of the vaccines. We have seen through our barrier analysis studies that the drivers of COVID-19 vaccine acceptance are very broad. And so community health workers, faith leaders, and others need to be on message. In closing, I wanted to share with you a quote by Samantha Power, who is the current administrator of USAID. In her keynote to launch the United Nations Behavioral Science Week back in June of this year, she said, "None of us are yet getting the most out of behavioral insights, and we will not get the most out of them. We will not optimize our programming and our leadership if we do not depart in critical ways from business as usual, from the way we're doing things now." Behavioral science is much more specific and more concrete than these broad ideas about meeting people where they are, about respecting local culture, about taking note of human behavior and adherence. Behavioral science is new. It's not old. It is not what we've been doing all along. And so what's exciting is to imagine behavioral science and the impacts it can make on our work and in doing more work internationally, not just on our programs, but in the way our organizations run themselves. We have to use better tools and devote more funding and attention to the demand side of COVID-19 vaccination. NDVPs and donor investments so far do not devote enough funding and attention to demand creation, and this funding and attention will be instrumental in assuring that we can stop the pandemic. In World Vision, we're very excited that we're seeing funding opportunities through Gavi to fund science-based COVID-19 demand-side formative research and interventions. Other donors and agencies need to follow suit quickly if we want to end this pandemic. Thank you.